to another episode of NTB Dialogues. As we know that we began NTB Dialogues at the midpoint since the government's committed to NTB in 2015. So about over 90 months have passed by since then, and 90 months are left to 2030. Progress towards ending TB is off the track in most places globally, barring few exceptions. So today we have a special guest, in Dr. Louine Morel, Medical Registrar at Communicable Diseases Control Unit at Seychelles. Welcome, Dr. Louine. How are you?
I'm good, thank you. Thank you for inviting me.
A real pleasure, and it will be important for us to learn insights from your very long tenure, at the Ministry of Health, and of course, being with the forefront of the fight against TB in Seychelles context. So, Dr. Louine, she has a very illustrious, brief bio. It's brief by no means, but I will just give you some highlights. She held her education at University of Otago in New Zealand, then did her further studies in dermatology at National University of Singapore, then in HIV/AIDS related further trainings and courses from University of Bordeaux, and then from tropical medicine, Royal College of Physicians in UK, and tropical medicine and international health from the prestigious London School of Tropical Medicine. So welcome, Dr. Louine. Really impressed and really privileged to have you amongst us.
Thank you.
So, thank you. So, Dr. Louine, as you know, we are at the midpoint of fighting TB globally in terms of timelines. So, can you please give us an overview? Where is Seychelles at currently compared to 2015? Is it on track? Is it what's the case burden and an overview? Over to you. Thank you.
Okay. So, as you know, Seychelles is a small island in the middle of the Indian Ocean. With this year, for the first time, the population surpassed 100,000. So we have a case incidence in 2016 of 9 per 100,000. And this year it went up. Last year, we had 15 cases per 100,000. So it's still overall less than 20 per 100,000. We are in the elimination phase, but we have noticed that the incidence has gone up a bit, or almost doubled, in 2022. But overall, what we've noticed is that we detected a lot of cases of extrapulmonary TB using GeneXpert. So that's why the number of cases went up a bit in 2022. But overall, the TB program is working very well, and we should be back on track. I think the incidence should go down for the next few years. The contribution of non-Seychellois to the TB burden is about 25%. So we do have a 15% population out of the 100,000 who are non-Seychellois coming into work in Seychelles. So there is a big contribution as well to the number of cases. We do screen as border control only with the chest X-ray. So hopefully later on we can introduce just the screening for latent TB as well, which is something that we were not doing. So for us to do that, we need to invest in better testing for latent TB, which right now we only doing the skin test of close contacts at the moment. So we do provide TPT also, prevention therapy, or to all, we screen the close contacts, and all those with positive results, we do offer them. But as you know, latent TB treatment is still optional. It's not compulsory. So some people start, or some still refuse. They want to wait until they get the TB for them to start treatment. But at the moment, it's still optional. So we do not get a lot of uptake on treatment for TPT. Yeah, for the TB in children, we haven't had a case for more than 15 years now in children, which is something that we will look forward for the future for us to do a study in the stool. We want to do the GeneXpert stool study and to see if we can detect TB in admissions, hospital admissions in children. so that we can certify ourselves that we are free from TB in children. Yeah, so that will be one of the few things we'll be doing next, hopefully in the next few years, for us to achieve the elimination of tuberculosis. I think if we do put all these things, we are able to invest in all these things to put in place, we will be probably the first country in Africa to eliminate TB. This is surely one of our goals.
Yes. Amen. Let's hope that happens. Really, all our prayers, and let's hope Seychelles leads from the front in towards TB elimination as well. So Dr. Louine, can you give us a better understanding? So, how of case finding? So, is it like symptomatic people come to the clinics or centers, or is it like active case finding, which is happening in other countries where you are screening people using chest X-rays and molecular tests? How is it happening? So can you just give us some sense of how is that done? Over to you.
Yes. So we can do the TB screening everywhere in the island, even as you know, Seychelles is a group of islands. Also on the main island and on the outer islands also, we can do the screening for TB. We can collect the sputum. So anyone coming into the health facility, a suspected case of TB, we will do all the sputum as rapid tests. A rapid gene expert, all the sputum. It's only the follow-up sputum that we'll be testing through microscopy. Yeah. So we do, as treatment, we're using the WHO guidelines for drug-susceptible TB. Whereas the second line, we only have levofloxacin at the moment. We have had 2 cases of query-resistant TB, but that was through the gene expert, but clinically the patients did respond to the normal drug-susceptible treatment. So it was not reported as drug-resistant TB. One of the main issues that we're having at the moment is that we are not able to do cultures, which we were able to do before. So we're having a lot of procurement issues. The cost of buying the LG culture media is more, the amount we need is very low compared to the freight that we need the cost of the freight to bring it in. So this is one area where I guess we can look for support or assistance from another country if they are able to help us. Other than that, we do have 4 gene expert machines. Yeah. So we're doing the regular screening for sputum. Like I said, all sputums, we will be screening doing the rapid test as first line.
Great. So no sputum smear microscopy as a first line. No sputum smear microscopy, right? As a first line for upfront.
No.
So 100% molecular test. Yeah. Great.
100%.
Amazing. Wonderful. Let's hope that happens in every country. Wonderful, Dr. Louine. So, Dr. Louine, I come from India, and in India, about in 2022, last year, about 23% of presumptive TB patients people with presumptive TB got molecular tests. So 77% got sputum smear microscopy. So different states in India are in the process of phasing out sputum smear microscopy, but it's going to take some time. Some states like Goa, Lakshadweep Islands, etc., they have already they've switched on to 100% molecular tests, just like Seychelles, which is great. So I was just wondering, in India, we are also doing a lot of active case finding in different states, especially to reach out to the missing people. And as you know, about half of, in our Indian TB prevalence survey, about half of the patients were asymptomatic. So they were diagnosed because of chest X-ray or by other means. So in that is why the role of active case finding is very important. And India, the most used molecular test in the country is called TrueNat, which is a decentralized and point of care test, battery operated, so which is the easier to use, more practical and pragmatic to use in our difficult to research. So I was just wondering, how is there any referral systems, like for instance, people with diabetes or HIV who are asymptomatic and are they getting screened for TB? And do you have any point of care, decentralized type, or is there a need for that in terms of Seychelles being a group of islands? Over to you. Thank you.
Yeah. So in terms of decentralization, it's the doctor that moves around the islands. Yeah, so we have monthly clinics on the other islands. Yeah, so, but the sample is collected on the outer islands and then transported to the main laboratory for testing. We do not have point of care tests on the main two other islands, which maybe it's something that we can look into. But like I said, we only had 15 cases last year for now. Yeah, for now, it's not an issue. I guess as the workload increase, if it is to increase, then we can see how we can invest further to the outer islands. Like last year, I did not get any cases from the other two islands, but there were some
Wonderful.
people that were screened from there.
Wonderful.
Cost-effective,
Yes.
yes.
Sorry, please continue. Please continue.
Yes, as a cost-effective measure to invest in the other two islands with much smaller population than the main one. For now, it's not cost-effective.
Right. Okay. Thanks a
But
lot for
with the
help.
active,
Yeah. Please, sorry to
yeah,
interrupt you again. Yeah, please
no, it's
continue.
okay. So, but everyone that comes in with an abnormal X-ray, even if they did not present with the specific symptoms of tuberculosis, we will advise screening for the sputum. We'll definitely move on to the sputum screening.
Right. Very important. Yeah, thanks a lot. And Dr. Louine, can you also just give us a better sense of the treatments? So for example, for latent TB, is it the 1 month regimen, the new 1 month regimen, which has been approved by the WHO, or the 4 month regimen for drug sensitive and 6 month for drug resistant, the BPAL M or BPAL L? So just wanted to have a sense of or are there plans
We're
for that?
still
So
on the
over to you.
6 month.
6 month for drug sensitive?
Yeah, we're still on the
Yes.
6
Okay.
month. Yes,
Yes.
drug
Okay.
sensitive. Yes.
And latent TB?
For latent TB also, still on the
6
isoniazid
Okay.
for 6
Okay.
months. Yes. We're going to review the guidelines. We'll see where,
Yes.
yeah,
Yeah.
hopefully we can review soon.
Yes, ma'am. Please do, because these treatments are very less toxic, shorter duration, and so more effective. So even in India, the shorter drug-resistant TB regimen is yet to be rolled out, the 6 month. But the studies have shown that the treatment outcomes are double. But you are right also about the caseload. In India, we have a very large number of cases with drug-resistant TB, probably the largest in the world. So it's a lot of, but still, even one person suffering from a disease which is preventable is a disease is enough, because that is so preventable.
Definitely.
Yes. Right. So thanks a lot. So, Dr. Louine, you saw some rise in TB. Was it due to COVID, or was it? Do you have any? Can we have some insights on? Yeah.
Yes. During the COVID period, like all countries, the GeneXpert machine was taken over for COVID testing. And for us, the same lab that was doing the TB tests was the one doing the COVID testing. So we did have major delay in getting results. And then we had a few, not a lot, a few TB and COVID co-infection as well. We think the increase in the number of COVID I think other countries also might see this, that as you know, you get repeated COVID infections, it lowers your immunity. So there might be an increase of the number of TB cases diagnosed in other countries as well. It's from the experience in the clinic, not in a study setting. So I think other countries might see it as well. And the other issue is that in Seychelles, we are still isolating TB positive patients. We were still doing that. What happened during COVID is that we could not do that. So most of patients were managed at their house with a family member responsible for giving them their treatment. Most of the patients did take the medicine. Only one defaulted. So I think this is one thing that we probably will still keep doing because most of the patients did adhere to the treatment. What we want to move now, because before during the COVID era, we did not have access to the main health centers as well for dots. So now slowly, we're going back to dots at the health facilities as well.
Right. And do you see the
So,
need for like portable or handheld X-rays which can go with the doctor? First of all, I should compliment Seychelles for, as you said, the doctor goes from island to island. The healthcare
yes.
staff is going. This is really important. I really wish that should be happening here, in so many more settings. If we had that kind of situation. So this is really important. So, so do you think that the handheld X-ray could be a practical screening tool if other countries or like the other donors want to support it? I think.
Yes, definitely. Definitely.
Yes.
But now on the two other islands where they have the main population, all the facilities have X-rays now at the moment.
Right.
They have. So yeah. So
Wonderful. So no
I
need,
guess it has to
right?
be
Yeah.
really
Okay.
remote population, but Seychelles is very small, very, very small.
Mm. Yeah.
Yeah, with
Okay. Yeah.
health facilities accessible within 20 minutes, 30 minutes. Yeah.
Yeah. Let's hope it's not about small, it's about keeping people safe and healthy, so which you are doing it so
Yeah.
diligently. So we really respect that, Dr. Louine, and really hope that it stays that way, it becomes even better. And please correct me if I'm wrong, perhaps Seychelles has eliminated malaria already. Is it true?
Yes, Seychelles for us, malaria is not endemic. We do not have the
Hmm.
mosquito.
Hmm.
Yeah, so it was never an
Wonderful.
issue. We
Great.
only get a few imported cases. Yeah. So
Okay.
because we don't have the mosquito, that's very it's
Right.
very good.
So good. So good. We deal with so many vector-borne diseases. It's not just malaria, dengue,
Yeah.
chikungunya, and so good that you are in that spot. So, Dr. Louine, what about the next 90 months? How can Seychelles, which is already having the TB pandemic under so much of control, there are very few cases, but
Mhm.
still, like how can you hit the zero and keep people and make it a reality that TB is preventable. And if anyone gets it, whether imported or domestic, there's a treatment and cure is possible. So, what needs to happen more? As you said, you already highlighted some of the actionable items. Which can probably help and boost the TB response, but just your insights. What more can happen?
Okay, for us, the key population would be injecting drug users, people who use drugs. This is one area that is causing us problem, which I think one thing we should invest in is to be more proactive in that group, offer them services, decentralized services for their centers, so that we can actively screen for TB, especially the contact tracing, so that they can be put on TB treatment very early. The other issue is adherence to treatment in that group of population. We have a lot of interaction with methadone and the TB treatment. So most of the time they choose the methadone over the TB treatment because they get withdrawal when they take the two together. So I guess this is one area that we really need to work really hard on it. The TB and HIV prevalence is still very low at the moment. Less than 10% of the cases that we get per year is HIV positive. But as the population of drug users grows, I think the association will get bigger. So this is one thing that we need to sort out. Right now, we do test and treat since 2014 for HIV. Maybe that's why the number, the co-infection between TB and HIV is very, very low. So as soon as you are detected HIV positive, you are screened, you are put on treatment for HIV. Everyone with low CD4 will be screened for TB and you will be put on treatment as well.
Yeah, very important,
So
Dr. Louine. Yeah, thanks. Sorry, you were saying something, please.
yeah, so the other group of key population is alcoholics also, that we're having a big issue. Not really with the diabetes yet, but with alcoholics again, with the treatment adherence, coming to the health facilities for treatment is a big issue. Yeah, so hopefully with the family support and the health facility support, we can get through that. Only a one-off, but it is an issue. Even if one patient doesn't take treatment, it's a very real issue. So we are conscious of this, that it does affect treatment adherence.
Yes, very important, Dr. Louine, for you to highlight the risk factors of TB. So TB prevention is not only about latent TB treatment, but also about reducing the risk factors like alcohol, which you said, injecting drug use, of course, alcohol, diabetes, HIV, as tobacco use, for example. So malnutrition. So I was reading the global TB report. Perhaps tobacco is tobacco use a problem in Seychelles context and malnutrition or not? Sorry for my ignorance, but like to know
Tobacco,
from you.
no, tobacco use, yes. Malnutrition, no. It will be the other side of the scale. Yeah, so, oh, sorry. So tobacco use, it is a big issue. Yeah. So we have more issue with obesity now than malnutrition. Yeah. It's another form.
Right. So,
Yeah.
so for tobacco use, are there tobacco cessation clinics which can refer people for TB, or like are there collaborative activities between them? Just curious.
At the moment, no, but there used to be, yes.
All
Support, yeah.
right. Okay, so about the people who use drugs, so to help screen them for TB, and you said decentralized. So is it will a decentralized point of care molecular test help along with portable X-ray or those kind of initiatives? Because so that we can know within an hour whether they have TB or not, whether they are resistant or not, and appropriate treatment can be provided quickly. So just out of the curiosity, just asking, or how is it done?
Yes.
Thanks.
Yes. So right now, it's only after they've been symptomatic for a number of months that they do present to the health centers for help. I guess definitely having a point of care test in the centers, in the opioid centers, it will definitely help for the key population, definitely. So we'll see how we can work with the other programs and see how we can set it up.
Yes, thank you so much. And so, Dr. Louine, thanks a lot for helping us understand the TB response of Seychelles and also the progress which has been made. We really hope that the TB levels in all other countries in Africa and Asia and the Pacific and Latin America and the world, all parts of the world, comes as low as Seychelles and even lower. We all need to end TB as soon as possible because TB is preventable and curable. And let us make it a reality in lives of everyone. So, Dr. Seychelles, as you know, sorry, Dr. Louine, sorry, you are, for me, you are Seychelles. So, Dr. Louine, you are my
That's
window
okay.
to Seychelles. So, Dr. Louine, please, as you know, the UN high-level meeting on TB is about to happen in about 2 weeks at the UN General Assembly. So, what will be your call to the world leaders to help, strengthen the response to NTB?
Okay, I would say that it is possible. As long as we get the financial support, it is possible to eliminate tuberculosis.
Right, absolutely. We need the fight to NTB fully funded, and which also includes the research and development pipeline for even better tools.
Yes.
It's such as vaccines, but also resources to implement what we know we already have, like the best of molecular tests, the portable held x-rays or whatever, the best of treatment regimens. That is also needs to become a reality, and let us hope it does. So thanks a lot, Dr. Louine. Is there anything else which you would like to add before we wrap up?
No, I would like to say thank you for inviting me. Yeah, I mean, usually Seychelles' contribution to TB worldwide is very small, but for Seychelles, because of the population size, is very significant. So we're still trying, and I thank the ministry for still funding the program and fully funded by the government. Yeah, and we're still trying our best to eliminate tuberculosis, and we'll continue the fight.
Thank you so much. Totally support this and totally pray that this happens and this continues to happen. Very proud that Seychelles government takes 100% care of the financial resources of the program, as well as, this is really important in terms of sustainability. But having said that, it is also important that support should be there for whatever more needs to happen in Seychelles and the countries too. So thanks a lot, Dr. Louine Morel. It was such a pleasure and honor to speak with you, a learning for me personally as well. And so friends who have joined us late, Dr. Louine Morel is a medical registrar at Communicable Disease Control Unit at the Ministry of Health in Seychelles, and a noted person when it comes to fight against TB in Seychelles, in Africa. So thanks a lot, Dr. Louine, for joining us again. And we hope that we'll catch up again with you when you are closer